Hey everyone, I wanted to go ahead and take a moment and actually talk through what does one of these major medical plans look like. On my screen, you will see our TPA on this plan, which is Clearwater. So Clearwater is a third-party administrator that is behind and backing this Clearwater plan. So this is their major medical 3500 plan. So why am I showing you this? Well, one, I want you to go ahead and see how this is actually built out. But two, I want to be able to talk through what makes this plan unique. So what is it about? What is it about this system? So you can go ahead and see it here. What do we have? What does this all mean? So let's walk through it real quick. So first off, this is a major medical plan, meaning that this is not a Christian share plan. This is not a limited benefits plan. This is full major medical. Copay 3,500. What does that mean? It means that within the in-network, you're going to go ahead and have copays. So that's essentially the plan built out. It's built out in such a way that you would have particular copays at certain amounts, and 3,500 indicates the deductible amount. So 3,500 is the deductible. When I say that, all of that sounds very familiar, right? That's nothing different than what you're used to. Most of you are used to a plan that has a deductible and copays. So as you can see on the screen, you are used to, I'm just saying you in general, because that's most people in their health insurance are used to what we would call a two-tiered system. So what is a two-tiered system? Let's see if maybe I can get this little pen thing here to work. That would be cool, wouldn't it? So a two-tiered system, cool. Let's see. Two-tiered system is here. So there's tier one in a normal sense, and this is tier two. So you are used to in-network and out-of-network. So, this is traditional insurance. So this is the way that you guys are used to it. You receive a plan, you have a deductible that you have to hit, right? So the deductible amount is what is your first dollar requirement before the plan pays out. You have a out-of-pocket max. What is it? What is your max liability that you would have to pay for following that deductible? And then underneath it, you begin to have your list of copays, right? So no cost for preventative care. You have a $25 copay for primary care, 45 for specialist, 45 for chiropractic, 45 for PT, and the list goes on. And if you are out of network, then you have a totally different set of costs, right? We understand that out of network would be more expensive than in network. That is a basic understanding of how insurance plans are laid out. Now, what makes this plan in particular very appealing and why it's unique and different than most things that you'll come across is this right here. So this is a tier one network. And you must say, David, what the heck is a tier one network or a preferred network? This is where it gets good. So if you can see, I kind of drew through it, but if you can see right here, this is showing a $0 deductible. What does that mean? If you go through the tier one preferred network, you will have no deductible requirements and no out-of-pocket costs to receive the care that you need. That's pretty incredible, right? So how do you access tier one? How do you access the preferred network? Well, you access the preferred network by calling into a healthcare advocacy line. It can also known as a healthcare concierge. So if you call into the healthcare concierge line and that you allow them to help you work through your care, it will be no cost to you. So are we talking about everything? It's like, well, if they help you find a specialist, right? $0. PT, mental health, urgent care, right? If you go through them to actually help you work through all of this, then you can receive $0 care. But hey, here's where it gets even more amazing. So these things up here don't typically cost that much in general, right? You're like, well, great, I don't have to pay my $45 copay. True. But when we start getting down here, all of a sudden, these are things that become pretty pricey. So we're talking about diagnostics, right? So diagnostics, imaging, hospital stay, right? Hospital stay and procedures. And guys, check this one out. $0 for childbirth. That was a terrible drawing. Let's circle it. That apparently is a little bit easier. Nope, it's not. Childbirth. Forgive my poor drawing. You can actually receive $0 for childbirth, meaning that if you work with the healthcare concierge line, you can actually have a child at the hospital. You can have maternity covered at no out-of-pocket cost to you. Again, I think that's pretty incredible. As someone who has at the time of this video, a 4 and 3-year-old, it wasn't that long ago since we just had a child. In fact, my brother and sister-in-law also recently just had a child. And this becomes a major concern for a lot of people, is how are they going to afford the cost of childbirth? So this gives you a way in which you can pay your monthly premium without having to pay for all these additional costs on top of it. So how does this healthcare concierge work? Right. So we've got this set up in order to take advantage of this tier 1. So what it requires is that you call in to the line, which I've stated. And how it will work is you're going to go ahead and tell them what it is that you need. So you'll say, hey, I'm going to go ahead and I need this knee surgery. Can you help me arrange for care? What they're going to go ahead and do is use the data available to be able to take a look at the providers and around you. So, right. So they're going to look you up based on your location, and they're going to say, hey, based on where you are, this is what we recommend for you. And they'll explain why. It may be, hey, this doctor at this location is going to be your highest quality, lowest cost option. And if you go there, we'll go ahead and cover it 100% for you. Let's just take another example of this. So say that whatever you receive from that healthcare concierge, so say this is the option that they give you. Say you don't like that option. Well, then you just fall back into tier 2. So then you just fall back into insurance the way it typically is done. Now it's the in-network. So now your deductibles and copays and all that stuff apply. And so you would just begin using your insurance as you normally would. PPO network is an in-network, out-of-network, that whole thing. So don't make it seem like you're being trapped in some way. You're actually not being trapped. What it is you're being given even more options and even more help. So by receiving the help, by having the options, it gives you a chance to say, hey, I would like to take advantage of that. Right. So why does this even matter? Why is this confusing? Why are they trying to help you manage care? Let's go back to our knee surgery example. You may be able to get a knee surgery and say, if you go get your knee surgery from this doctor over here at this hospital, it's going to cost you $15,000. But you can get that surgery from that doctor at this outpatient clinic. It's going to cost you $5,000. Right? That's a $10,000 savings from the same doctor to do the same procedure at just a different location. These are things that the concierge team is going to be able to look up. Those are the things that they're going to be looking for. Or what about this? It's going to be, hey, I know this is the doctor that you were recommended or the one that you were looking at going to, but did you know that he has a 50% chance of a repeat on his surgeries? So meaning that we can pull all the data, see how many times he's done this procedure and how many times he's had to redo this procedure, meaning that the first time wasn't successful and they had to go back in and do the surgery again, right? That's a data point that you actually really would like to know. That's very important because it's not about the label on the outside of the hospital or whatever, or who they're connected with. That actually will tell you if that doctor is good. And neither will your aunt or Google Google 5-star reviews, right? That's not necessarily a good indication of the success or the quality of that doctor, right? You may not know that that doctor is being currently investigated for something, right? That may be something that doesn't pop up. So the ability to have someone to go to be able to actually look at all of your options and give you the kind of the best advice for you is in some cases life-saving. Like, it's definitely life-changing. uh, it all of a sudden you don't have to pay for your surgery if you go there. And you go, well, why would this plan be built in such a way where they're giving stuff away like this? Well, I kind of already told you. If you are going to use the insurance, if you're going to use your plan and it was going to cost $15,000 to use the insurance, but they're able to get you something even better at a third the cost, that just saved the plan $10,000, right? That's the incentive. The incentive is it helps manage the cost, right? And Clearwater's been so good at helping manage this that they haven't had a rate increase on these plans in 4 years. 4 years. So think about it. When was the last time your health insurance didn't go up in 4 years? Yeah, exactly. The answer to that is never, because I don't know anyone else currently that's been able to maintain rate stability like that over the long haul. And part of the reason why is this, right? They're making it so good for you to be able to get the help, so that way you can have someone actually navigate this with you, that they've been able to be really very good and effective at managing the spend within this. And like I said, it just gives you the options. If you don't want to use their suggestion, if you're like, no, this is where I'm going, then you can, right? It's not a handcuff. It's not an ultimatum. It's an option. And in a time like today, options are king. Options are key. You want options. You want as many options as you can have. So that's about it from this. I wanted to just be able to work you through this really quickly of why it's so valuable, why it's so beneficial, and really why it's unique in today's health insurance environment. So this plan's innovative. It's incredibly successful. And I believe the people who are willing to go on this are going to get the type of care that they need. So if this interests you, please reach out. I would love to go ahead and get you connected with this. I should be able to get a quote link below. If not, reach out to me. I can get you one so we can go ahead and get you a quote on this. Or if you just have questions, if you're like, if I didn't answer everything that you were looking for, if there's still some questions out there, you're like, hey, actually, I got a few more things I want to ask you, please reach out. I'm happy to talk to anybody about this and be able to help them. So with that, I'm going to go ahead and sign off, but thank you so much and hope you guys have a great rest of your day.